AI is as everywhere. AI is coming in a big way into this. The term neurophysiotherapy itself is becoming more and more advanced.
So hello everyone, we are again back with some new and interesting questions. So I am with Professor Dr. Iype Cherian. Sir is a neurosurgeon and director of Neurosciences at Parul Sevashram Hospital. So sir, my first question is, many times we see the patient with a surgical success, but a functional recovery still remains a challenge. So from a neurosurgeon's perspective, what is the role of neurophysiotherapy in translating this surgical excellence in meaningful functional recovery?
Yeah, so the neurosurgeon can only remove a tumor or maybe anastomose a certain vessel to an area which requires more blood and things like that. But functional recovery is more on how the neurons get better along with time. So for this, the new neurophysiotherapy involves VR, robotics, EEG, brain-computer interface, and many more things. So the term neurophysiotherapy itself is becoming more and more advanced. AI is as everywhere. AI is coming in a big way into this. And I guess a combined effort where a good surgery plus good infra plus an educated neurophysiotherapist will play a huge role in changing the outcomes of these patients.
So, sir, as you mentioned about this VR, like advanced technologies, robotics, VR, and brain-computer interface. So, how if we combine a neurosurgical like STMC bypasses, which you do, and a neurophysiotherapy? So, can it be a best way to improve the neuroplasticity?
Yes. So, in STMC for strokes, what we are doing the salvage of the penumbra. Now, once the penumbra is salvaged, we have to make those neurons fire like earlier and get the functions back. For that, earlier only passive movements and active movements were practiced. But today, with transcortical magnetic stimulation, you can stimulate the motor cortex. With EEGs, you can get feedbacks. With robotics and brain-computer interface, you can bypass certain things so that you can get movement even when the brain wants it to. Then, with robotics, VR, you can make the patient also believe that, she or he is moving, and this really improves plasticity. So, with all these lined up, we're looking at a massive improvement in what was the functional outcomes for these earlier to the present.
Yes, sir. Thank you so much for this very good insight for neurophysiotherapy. So now my next question is, how do you define the longevity, not just in terms of lifespan, but sustained excellence and purpose?
Yeah, so imagine it this way. Time is moving in one direction and you are standing there. What happens is, as time moves, if you do not improve your levels of fitness, time has a particular way of breaking everything down. So I remember when I was 25, it was much easier for me to get fit. Today, at After 25 years, I find it much more difficult. So I understand that my levels has to go up. So first thing is the understanding that you are not retiring or you are not coming down on your effort. You are actually going up on your effort. If you were doing 20 pull-ups, you need to be attempting 40 or 50 pull-ups. If you were doing 50 push-ups, you have to attempt 100 push-ups. That's the only way you can stop time from degenerating what you have. That's number one. Number two, I do not agree with the idea of supplements and of course other shortcuts for longevity. There are no shortcuts to it, and you have to take the right food, you have to have the right discipline, of course you have to have the right mindset also. You have to understand, this is something that when you meditate you have to understand that it is not the brain which makes consciousness. It is the other way around. It's the consciousness that makes your body and your brain. So if you are able to tap into consciousness, it can change anatomically your body and your brain. This is very important.
Yes. So, sir, we often see that neurosurgery requires a high pressure decision making, and we also seen you performing ultra micro neurosurgery, which requires a very, we can say, still zero tremors. So, mindfulness or meditation influence the way you approach these complex surgeries.
Knowledge trumps fear. This is the thing. So, if you perform in the lab at a level much higher than required, then when you get into surgery, you know that you've been there and you're able to salvage that situation. So I believe training, for example, net practice for all the cricketers, just like that, training to the highest level possible till you fail, and then you take the next step where you don't fail at that particular level is very important. And this, more than mindfulness or more than courage, the knowledge that I have done it and I can do it again is what is important for a surgeon. Of course, when a new situation arises, when a new complication comes, your ability to have grace and think quiet and have a clear solution rather than be frayed by all the emotions is important too. That said, practice and improving your skill set is most important.
Yes. Thank you so much. It's an honor to learn from you about the longevity and all. Thank you so much.